Doctors were killing mothers with their own hands, not by accident and not by anything they would have called malpractice. They walked out of the autopsy room, wiped their fingers on their coats, and delivered babies. And in one Vienna hospital, roughly 1 mother in 10 died screaming with fever within days of giving birth. The hospital knew. The mothers knew. Women got on their knees and begged to be sent through the other door. This is the story of the man who worked out why and of what medicine did to him for it. Vienna General Hospital, the 1840s. It was one of the most respected teaching hospitals in Europe, and it ran a free maternity service. Poor women came in to give birth for nothing. In exchange, the hospital used them to train the next generation of doctors. The maternity service was split into 2 clinics, and admissions alternated by day. First clinic one day, second clinic the next. First clinic was staffed by doctors and medical students. Second clinic was staffed by midwives. Same building, same beds, same women, sorted by nothing but the calendar. And the death rates were not remotely the same. In the doctor's clinic, childbed fever killed around 1 mother in 10. In the midwife's clinic, it killed roughly 1 in 25. Some years, the gap was worse. The women of Vienna had noticed this long before anyone with a medical degree did. That is why they begged. Records describe women weeping and pleading to be admitted on midwife days. Others deliberately gave birth on the street outside and then turned up claiming they had simply been too late. A street birth had better odds than the finest teaching hospital in Europe. In 1846, a 28-year-old Hungarian doctor named Ignaz Semmelweis was made assistant in the first clinic. He was blunt, awkward, not remotely charming, and he could not leave the numbers alone. Every month he counted the dead. Every month the same clinic buried more of them. Childbed fever was not a gentle death. It began with shivering a day or 2 after delivery. Then fever, then a swollen and agonizing abdomen, then infection spreading through the blood. Most were dead within a week. Their newborns very often followed them. The medical establishment had explanations, and all of them were nonsense. Bad air rising from the ground, an imbalance of the humors, overcrowding, the emotional shock of childbirth. One popular theory blamed the priest who walked through the doctor's ward ringing a bell for the dying and frightening the mothers to death. Semmelweis actually tested that one. He asked the priest to take a different route and to stop ringing the bell. The mothers kept dying at exactly the same rate. He tried changing delivery positions. Nothing. Whatever was doing this did not care about bells or posture or fright. The answer arrived in March 1847, and it cost him a friend. Jacob Kolechka, a professor of forensic medicine, was performing an autopsy with his students when one of them slipped and nicked his finger with a scalpel. It was a tiny wound. Days later, Kolechka was dead. Semmelweis read the autopsy report on his own friend and felt the floor move. The damage inside Kolechka's body was identical to what he had seen in hundreds of dead mothers. The same inflammation, the same spread. A man had died of childbed fever, and he had never given birth. So the disease was not about birth at all. It was something carried out of a corpse and into a living body through a wound. And then Semmelweis thought about his own mornings. Doctors and students began every day in the autopsy room, cutting open the women who had died the day before. Then they walked upstairs with nothing more than a rinse of plain water and put their hands inside women in labor. The midwives in the other clinic never touched a corpse. They had no reason to. That was the entire difference. That was the 1 in 10. Remember, this is decades before germ theory. Nobody had proved that invisible organisms cause disease. Semmelweis had no microbe to point at, no photograph, no name for it. He had a smell, a pattern, and a body count. He called it cadaverous particles, wrong vocabulary, right killer. In May 1847, he made a rule. Before touching a patient, every doctor and every student in his clinic would scrub their hands in a solution of chlorinated lime until the smell of the dissecting room was gone. He chose it because it destroyed the stench. That detail turned out to matter enormously. In April, before the rule, the death rate in his clinic had hit 18%, nearly 1 mother in 5. By June, it was 2.2%. In July, 1.2. He had not invented a drug or a machine. He had made men wash their hands in a bucket. For a while, it looked like triumph. He extended the rule to instruments as well, after an outbreak that started from a single infected patient. The numbers stayed down. In 1848, in 2 separate months, his clinic recorded no maternal deaths at all. Not one. And this is where the story stops being a medical breakthrough and turns into something uglier. Because Semmelweis had not simply found a cure. He had told the most respected men in European medicine that they personally carried death into their patients on their fingers for years by the thousand. The gentleman doctor of the 1840s considered his hands clean by definition. Clean hands were a question of class, not chemistry. Being ordered to scrub in chlorine before touching a patient was not a hygiene instruction. It was an accusation. And his superiors heard it exactly that way. His boss, Johann Klein, was one of the men implicated by those numbers. In 1849, Klein simply declined to renew Semmelweis's appointment. No debate, no trial of the method, no committee. The man who had cut maternal deaths by a factor of 10 was quietly shown the door. Semmelweis also made it easy for them. He barely published for years. He turned down chances to explain himself properly. When colleagues asked him for a paper, he sent almost nothing. His evidence was overwhelming, and his presentation of it was a catastrophe. Being right is not the same as being persuasive. He left Vienna without saying goodbye to his colleagues and went home to Pest. There, he took an unpaid honorary post at the small St. Rochus hospital, walked into a ward with a childbed fever problem, imposed his washing rule, and drove the death rate down below 1%. Again, in 1861, he finally published his book, The Etiology, the Concept, and the Prophylaxis of Childbed Fever. It should have ended the argument. Instead, the reviews were dismissive and the profession moved on. So Semmelweis started writing letters. And that is where it turned. He wrote open letters to the leading obstetricians of Europe and called them murderers. Not as a metaphor. He wrote that any doctor who refused to wash his hands was, in his words, a murderer, and that the massacre had to stop. He named names. He signed them. He sent them everywhere. He was, of course, factually correct. He was also, professionally speaking, setting himself on fire. Colleagues stopped defending him. Friends called him unbalanced. His behavior deteriorated. Drinking, outbursts, obsession. Possibly an illness of the brain. Possibly just a man watching preventable deaths continue while being told to calm down. In July 1865, his colleagues arranged what we would now call an intervention. A respected friend, the dermatologist Ferdinand von Hebra, invited him to come and look at a new institute in Vienna. Semmelweis went. The new institute was an asylum. When he understood and tried to leave, the guards took him. He was beaten by the attendants, put into a straitjacket, and locked in a darkened cell. He was 47 years old. Somewhere in that struggle, he took a wound to his right hand. And in an asylum, in 1865, nobody washed anything. The wound went septic. 14 days after he walked through that door, on the 13th of August 1865, Ignaz Semmelweis died of an infection in his blood. The same thing that killed the mothers in his ward. In the same way. For the same reason. Barely anyone came to the funeral. His old clinic in Pest dropped the hand-washing rule after his death, and the death rate promptly climbed back up. 6-fold. Nobody in Budapest asked a single question about it. His obituary in the medical press was short and unkind. The men he had insulted outlived him and won the argument by default. Then, within a few years, Louis Pasteur showed that microorganisms cause disease, and Joseph Lister began using carbolic acid to sterilize surgery. Suddenly, invisible killers on human hands were not an insult. They were a mechanism. Semmelweis had been describing that mechanism badly for 20 years. There is a name now for what happened to him. The Semmelweis reflex. The automatic rejection of new evidence because it contradicts what a profession believes about itself. And here is the final insult. No doctor coined it. A science fiction writer did in 1979, 114 years after they buried him. So here is the part worth keeping. The doctors of Vienna were not villains. They were educated, respected, well-meaning men who could not accept a fact that made them the cause. Roughly 1 mother in 10 paid for that comfort. Semmelweis did not lose because his evidence was weak. He lost because his evidence was insulting, and he was terrible at making it easy to hear. Wash your hands. And when the numbers say you are the problem, try to be better at hearing it than they were.